Exeter Hospital, together with its affiliates Core Physicians and Rockingham VNA and Hospice, has proactively established a system-wide, clinically led team to prepare for and respond to the potential of a coronavirus or COVID-19 outbreak in the Seacoast. They are working closely with the NHDHHS as well as the CDC and are actively staying in compliance with their recommendations, including implementing extensive screening protocols, including, but not limited to, establishing screening at entry points to the hospital and its affiliated locations. In order to protect patients and staff, they are asking the following. Refrain from coming to the hospital campus unless you have a scheduled appointment or procedure or require emergency care. At this time, we are not allowing any visitors. Exceptions will be made for pediatric patients, end-of-life, and family center patients. No visitors with respiratory symptoms, fever, or who've traveled outside of the country. Cafeteria service is no longer open to the general public. Food service will still be available for patients, staff, and visitors. Valet services have been suspended, with the exception of service for those individuals with disabilities. We may limit access further in the future to remain consistent with CDC guidelines, so please check the hospital website if you are planning a visit. We are continuing to enforce limited access to our building. This includes hospital and off-site locations, including core physician practices. And everyone from the general public will be screened to ensure that they do not have active symptoms or have been exposed to someone who has. Effective March 16, 2020, we are dramatically limiting all non-urgent elective surgical procedures, certain pain management procedures, and all screening colonoscopies. Our surgeons and specialists are ensuring that all clinically necessary cases are going through. We are contacting each scheduled patient individually. Exeter Health Resources has implemented a social distancing policy, and we have limited staff travel. The hospital and its affiliates are continuing to work with the NH Department of Public Health, the CDC, and the NH Hospital Association on coordinating our efforts and ensuring that we have the necessary resources to safely and effectively continue to provide care for the community at large.